Hello, Elevation Health family. This is Dr. Dave Yachter, the chiropractor. I want to thank you for joining me today, and we will be discussing a new topic concerning fibromyalgia as our topic of the week this morning. This is one of the most common chronic pain conditions that we see. It affects an estimated 10 million people in the United States, mostly prevalent in women, about 75 to 90% of the time, but it also occurs in men and children of all ethnic groups. The fibromyalgia diagnosis is usually made between the ages of 20 and 50 years, but the incidence of diagnosis rises with age. Typical symptoms of fibromyalgia is just chronic widespread body pain. That's the primary symptom. It's just you hurt all over, very, very tender to the touch, and it doesn't take much pressure where you push in on any part of the body. Most people with fibromyalgia also experience moderate to extreme fatigue, sleep disturbances, sensitivity to touch, light, sound, and also experience cognitive difficulties. Many individuals also experience a number of other symptoms and other overlapping conditions such as irritable bowel syndrome and also migraines and headaches. So, what causes fibromyalgia? Well, honestly and truthfully, any person of science and research who has studied this and continues to look for answers will tell you that the underlying cause of fibromyalgia is not yet fully understood. Most researchers agree that fibromyalgia is a disorder of or the dysregulation of the nervous system, which causes pain amplification due to abnormal sensory processing within the nervous system. Other studies now show that many of these patients have low levels of serotonin and tryptophan, and also abnormalities in something called cytokine function. And cytokine is responsible for inflammation. In some cases, inflammation is good in your body for healing, but sometimes when your body has something called a cytokine storm, that inflammation can be rampant, out of control, and very, very painful. So, what is most commonly used to control pain or pain management is pharmacological drugs. Lyrica, Cymbalta, probably two of the most common drugs that we've heard of because we see them advertised on TV, brand name prescription drugs, which are most commonly used. And many of these have dangerous side effects, short-term and long-term. And other times, other healthcare providers may provide non-narcotic pain relievers like tramadol or low doses of antidepressants, which, as we've spoken about, antidepressants do also come with dangers of side effects. And we talked about that on previous episodes. So there is a time and a place where medications and pharmacological prescriptions may be necessary short term, especially in the area where people are not aware of what else to do. It's, if it's their only choice and they're not aware of any other knowledge or options, I can understand that. But the more you understand about fibromyalgia and the more you understand the best approach, you start looking for treatment alternatives, which really are conservative. They don't have side effects, and they start getting to the root, the cause, and the source of the problem. And, hopefully there are people who do experience support from their primary health care providers where there is a discussion on lifestyle corrections, because it's well known that when you start correcting lifestyle, that it really does help reduce a lot of the symptoms of fibromyalgia and pain and other health disorders. Things such as simple as just getting on a regular sleeping routine, a regular sleep rhythm, going to sleep the same time every night, waking up the same time in the morning, a cool, dark room, shutting out all the light, not using any sort of phones or tablets or electronics or watching TV right up into the minute that you go to sleep. This is sleep hygiene they refer to. Proper nutrition, anti-inflammatory nutrition. We discuss a lot of that at our workshops, anti-inflammatory supplements. Of course, managing stress. Stress is highly inflammatory to the body. We know that, and that's why stress management is so important in managing our health, especially the fibromyalgia patient. And then light exercise and movement. Brisk walking can definitely help a person with fibromyalgia. So these types of things, in addition to other complementary therapies, have proven to be very, very beneficial. Some people benefit from physical therapy. Others benefit from massage, acupuncture, yoga. As I said, anti-inflammatory nutritional supplements are worth their weight in gold when they're applied properly, when you have a good quality product and you have a good strategy to help reduce inflammation, widespread inflammation in the body. And then, of course, last but not least, chiropractic care. And it's well known today the beneficial effects the chiropractic care can offer the fibromyalgia patient. Why is that? Because, as we said, the cause of fibromyalgia is not yet fully understood. However, they know that it has its roots in the nervous system. And as chiropractors, that is exactly what we work with. That's what I work with. When a patient comes in, if they have fibromyalgia, if they have headaches, if they have irritable bowel, if they have, it doesn't matter what they have. What I look to do is examine the spine to find subluxations. Subluxations are vertebrae, individual vertebrae that have shifted out of their normal position, which are no longer protecting the spinal cord and the nerves, but now interfering with them. That interference can cause irritation. That irritation can cause a or a miscommunication, a dysregulation, as far as the brain communicating with the cells, organs, and tissues by way of those nerves. And when you have dysregulation, you have disharmony, dysfunction, and dis-ease. It's kind of like static in the nervous system. And of course, that very well can cause amplification of pain in the fibromyalgia patient very easily, in addition to a whole host of other health issues. So when I correct subluxations, when I remove that interference and restore the integrity of the nervous system, the communication of the brain to the body, I remove the interference from what's stopping the body from healing itself. It's as simple as that. Now, that's not to say what I do is a one-hit wonder. When I move the bone, I know that God does the healing, but I also know that God created laws when it comes to healing. And one of those laws is time. Okay, so if it takes time for a condition to develop, it usually takes time for that condition to heal. And normally we communicate that up front to all of our patients. And I can tell you one thing, I can guarantee you this, regardless of if it's fibromyalgia or any other condition, that an individual will be better off without subluxation than if it was left there to get worse, without a doubt. And more often than not, we see people respond beautifully to fibromyalgia. And Lord knows a myriad of other conditions when they're under chiropractic care. When we adjust them, the body just does better. When people get adjusted, the healing capacity is unleashed and they can fully realize their human potential. And that's what I love about it. It doesn't matter what the disease is. When you find and correct the cause of the problem, the body heals itself. And that's how it applies to fibromyalgia as our condition of the week. Hopefully this makes sense. I don't know if you know people with fibromyalgia or are hurting, sick, or suffering, but share with them what you've learned because you can be a blessing. Thanks for joining me today. I love and appreciate you. God bless.